Hi, this is Dr. Sylvester at the Next Step Foot and Ankle Clinic, and I'm excited to talk to you about a couple of reasons why you may want to see us at the Next Step Foot and Ankle Clinic if you have an ingrown toenail. There's a lot of places you can get an ingrown toenail taken care of. There's the emergency care clinic, there's the hospital emergency room, there's other doctors that treat ingrown toenails, but I'm going to tell you why I think we do things a little bit, I think, better and a little bit more special. First of all, the injection. What everybody fears, and rightfully so, in getting an ingrown toenail done is that you've got to get the toe numbed up, and that involves an injection. Now, we use 5 techniques to make our injections as painless as possible. Now, they're not painless, nobody's is, but almost everybody can tolerate them without too much trouble if they'll just work with us. I've done this injection on 4-year-old kids, and they haven't cried. You know, if you can just get them to relax and talk to you, it hurts a little bit, but it's very, very tolerable because of these 5 techniques we use that I think are pretty effective at lowering the pain of the normal pain one would expect in an injection. We've all heard stories of people taking a nail, a syringe, and sticking it underneath the nail and injecting that area, and it's excruciatingly painful. Well, ours are not. That's one reason. The second reason, I think, is because we use 2 methods. Well, for example, if you want to get the ingrown toenail borders, the sides, destroyed so they don't come back, that involves usually the use of a chemical. And most people use a chemical called phenol, others use sodium hydroxide. There's a few different types of things you can do to kill the root. But what we do is we actually use 2 methods. And the reason that's important is, number one, the second method, we use a chemical first and then we use a electrical cautery bifurcation type technique. That combination kills a lot of bacteria. So there's very low infection rate with that procedure. 2 is there's a lower recurrence rate because you've actually treated the nail twice. The nail root is not, you're more sure of your destruction because you've treated it in 2 different ways. And thirdly is it seems to, for me, at my practice, it seems to heal faster because when you use just the chemical, you leave a lot of dead cells in the toe, and the body has to clean those out. Well, you don't have to clean those out if you use the electrical cautery machine, so it's a little more expensive. Actually, it's a lot more expensive to buy that machine to make it work, but I think it really improves the results for our patients. And I'm a pretty firm believer that if you have an ingrown toenail, you should probably see us, because we've really tried to make it a much less traumatic and much more successful procedure for our patients. Anyway, thanks for listening.